If you're struggling with back or leg pain from a low back disc bulge, here's the 4 best exercises to help you improve quickly and 3 things that you've got to stop doing. Okay, let's start off with the 3 things that you should never do if you've got a low back disc bulge. First and foremost, don't stretch your hamstrings. I've seen countless patients in the last 30 years in practice worsen their symptoms by doing this. When a disc bulge irritates the nerve that goes to your leg, it can make the back of your leg feel tight, sore and stiff. So it feels like a stretch would help, but this sensation of tightness actually comes from the nerve irritation, not muscle tightness. Stretching your hamstrings stretches the sciatic nerve running down the back of your leg, making leg pain worse. So whatever you do, don't stretch your hamstrings. Secondly, with disc injuries, you have to be particularly careful not to do any exercise that hurts. Pushing through the pain will make you worse. Any exercise or activity that increases pain in your back or leg is increasing inflammation around the damaged disc, prolonging your recovery. So listen to your body and stop whenever you feel pain. The third thing that you should avoid as much as possible is any activity that flexes or rounds your back. Bending with a rounded back or sitting with a rounded back pushes the disc further back into the spinal nerves, causing more damage, inflammation and pressure. So always bend with a straight back, especially if you're lifting anything. And never sit with a rounded back, especially on a couch or sitting in bed. Always sit in an upright position with something to support the natural arch of your lower back. Okay, let's look at the 4 best exercises to give you the quickest relief. At the top of the list is lumbar extension exercises. These tend to give the greatest relief, because if you flex your spine, that tends to push the disc back towards the nerve, causing pain. So it makes sense that extending the spine will relieve that pressure. Firstly, you need to test this position. To do that, simply lie on a firm surface and lift up onto your elbows. If that feels sore, don't do this exercise. It's not for everyone. But if it feels good, just a bit stiff, or simply pain-free, hold that position for 30 seconds the first day, and then begin doing it for 60 seconds a couple of times a day after that. The second exercise that can provide amazing relief is a decompression exercise. Opening and separating the bones in your spine can help to draw the disc back in, and there's a couple of easy ways that you can do that at home. The simplest way is to hold yourself up between 2 sturdy chairs or stools and let your body hang with your toes just touching the ground. Just let your back and stomach muscles relax and do that for 10 to 30 seconds, 3 times in a row, once a day. If you find that a bit too hard on your arms, you can hang in a similar way, relaxed with your toes just touching the ground, by leaning on your elbows on a kitchen bench top or a sturdy rail. Now, sometimes the nerve that's coming out of the spine can form some painful adhesions to a damaged disc. But a nerve floss exercise can break up those adhesions and increase blood flow around the nerve, so this can really help some people. Test it gently first though. Set up sitting on a bench that's high enough for your feet to hang freely. Then step 1 is slowly looking down and rounding your upper back. And step 2 is straightening your upper back and looking up as you straighten the leg with sciatica. Alternate between those 2 positions slowly for 30 seconds. Feeling a bit of a stretch in your leg or back as you move is okay, but if anything hurts your low back or leg, make the movement smaller or stop completely if you can't do it pain-free. The 4th thing that you need to do is some gentle cardio. Spending too much time lying down or sitting down all day starves the disc of healing blood flow. But low-impact cardio, like walking or swimming regularly, if you can do them comfortably, increases the blood circulation in your lower back and will make your disc heal faster. Most disc pain will significantly improve in 2 to 3 months, but some cases take as little as 4 weeks and other cases can take over 6 months to recover. A good sign of improvement is called centralization, which is when pain reduces first further down in the leg and the pain over time moves back towards the spine. Now, if your pain is severe, any leg numbness is constant rather than intermittent, you get any muscle weakness, or experience any bladder, bowel, or sexual difficulties, see your doctor straight away. Just be aware that misdiagnosis is very common with disc bulges. At least 60% of people over the age of 50 have a disc bulge, but the majority of these disc bulges simply don't bulge out far enough to irritate the spinal nerve. So if you've got back pain but no leg symptoms, and your doctor's ruled out more serious causes of back pain, the exercises in this video could do you wonders.